Welcome, everyone. This is Pam Dunwald, one of your nurse advocates with Your Nurse Advocate Consulting. Today we are going to empower family caregivers just like you with the knowledge and the skills to, effectively navigate the healthcare system, which is a lot of reasons why we get a referral for clients is people are just feel like they're not getting anywhere and they don't feel like anybody's listening to them. So today we're going to walk you through some of the challenges, provide some practical tips, and we've got a story or two to share depending on how time allows. I like to, keep this around 15 minutes. So just want to be able to provide you some value and without dragging this out too much. So the first section or first challenge, we're gonna call it understanding the healthcare system just in general. So let's break down the healthcare system. When we're referring to navigating the healthcare system, what exactly does that mean? Well, the healthcare system, it's made up of hospitals, doctors' offices, pharmacies, insurance companies. Each one of these entities really play a critical role in your loved one's care, but it can be really overwhelming to manage them all, especially when there's multiple doctors, multiple clinics. A lot of times one hand doesn't know what the other one's doing because we think that we live in a world where we have all this technology and everything is online. Everybody should be able to access this, but not all of the EMR or electronic medical records programs talk to each other. There are many different kinds. So especially if you're out of your area, you could be in a state, if you're on vacation or whatever, you could be at a place where they can't connect to your medical records. So it's really important to understand how these components work together and, to be able to have effective navigation. So one of the things, when we're looking at the healthcare system, one of the things that you can do right away, and if you go to our website, it's just yournurseadvocateconsulting.com, and click the tab free resources. We have a lot of free resources. One of them is a emergency to go folder. So it's fill in the blank contents for you to make a folder that would have all the information in it that another hospital, say if you're out of town or on vacation, or maybe you're out of the country, you could have this with you that would have everything that they need to provide adequate care for you. And so that's one of the things that would help you navigate the healthcare system is by having readily available information that could ensure that you're getting proper care. So that would go along under understanding the healthcare system. Also understanding the healthcare system and just knowing your rights as a patient or a caregiver of a family, of a loved one or an aging parent or grandparent is really, really crucial. It can be like learning a new language. And I'll give you an example. And maybe this isn't the best example, but I have a t-shirt. It says 750 milliliters, ETOH, PO, TID, PRN, stress. Now, unless you're a nurse, or a doctor in the healthcare field, you're not going to know what I just said. It will make no sense to you, but it's a perfect example. So what it means is 750 mLs, 30 mLs is 1 ounce. So you can do the math and figure that out. So 750 milliliters. ETOH is the chemical abbreviation for alcohol. PO is by mouth. TID is 3 times a day. PRN is as needed for stress. So now I've just decoded what that said to you, and it may be a silly thing, and not that I'm promoting drinking for stress, but it's kind of funny because it's one of those things that if you don't know the language, the healthcare system, you would never know what that meant. And so that's a great example of how difficult it may be to navigate the healthcare system. So it's like learning a new language, but with the right guidance, and it becomes manageable. And so this is one of the ways that us as nurse advocates can come alongside you and help you interpret and navigate the healthcare system. So the second thing is part of this whole process would be becoming an effective advocate. So when we say an advocate, yes, I'm a board certified patient advocate. My partner, Linda, we're both RNs. She's also a board certified patient advocate. But that doesn't mean that you can't become an advocate for your loved one. Maybe you have some experience in the healthcare system. Maybe you don't need us for this one particular issue that you're working with. But being an effective advocate, means really standing up for your loved one's health, and really don't be afraid to question things. Don't be afraid to get a second opinion. We live many years ago, and so some of our aging adults, those that are in their 70s and 80s, they come from a background where anybody in a white coat is, they don't question them. They do what, they feel that they're the expert. They do what they say, and they never question, and they never, they hold back because they always say doctor knows best. And so in this world that we live in now, there's more heightened awareness, there's more consumer awareness. There's more people are being encouraged to question. If you don't understand something, question it. If you're not liking what you're hearing, ask for a second opinion. There's nothing wrong with that. In every profession in the world, there are people that excel, there are people that are average, and there are people that are below average. And one thing about seeking, medical help is that, you and your provider, whether that's a physician's assistant, a nurse practitioner, a doctor, or a specialist, it has to be a good fit. You have to be on the same wavelength as far as what you want. And if it is different, then at least that provider needs to respect your opinion and say, okay, we're offering patient-centered care. Patient-centered care means the care is directed by the patient, not by the doctor or the healthcare professional. So, you really don't hesitate to speak up if something doesn't feel right, or you're questioning a medication that they want to get you started on. What are the side effects? What are the risks and benefits? What if I don't go on the medicine? What if I do? Make sure you are well informed about any of the consequences so that you can make an educated decision. So effective communication is really the key. When family caregivers, when they clearly convey their concerns and their needs, it really does empower them, the entire healthcare team, to provide better and more personalized care. So that's by speaking up, you're only making it better, for your loved one. So please don't hesitate to ask questions. One of the things that we do have on if you are a part of our weekly newsletter, we have Senior Saturdays every Saturday morning. I send out a newsletter with all the things that we've shared during the week. And one of those things that you get on that when you're on that email list is we have a prep for the doctor appointment form. And it's a guided form for you to be able to jot down your questions and get ready and get prepared for that doctor appointment, so you don't forget to, when things are rushed and you have your questions all laid out. And the doctors and the providers, they really appreciate that. They will get your questions answered, and they really like when you're organized and have it ready to go, because that makes their time more efficient, but yet they can address your concerns. So number 3, navigating medical records and insurance. So navigating medical records, even the military, they have an online patient portal. What does that mean? That means that you can get access to your online records. You could get access to lab tests, x-rays, the doctor's notes from your visit. You could read what the doctor documented, what's going in your chart. You can see your appointments. Every clinic and hospital system has this patient portal access. So make sure that as an adult child of an aging loved one, or a grandparent, or a spouse, make sure that you ask to get access to their online patient portal. This is one sure way that you can help navigate the system. You can read what the doctor says. If they forget to tell you when they went to the doctor, they don't remember what they said, you can go back and read the doctor's notes. You could see what they're supposed to be doing. You can double check, make sure they're not missing appointments. That is a very, very simple way of staying on top of things and navigating the healthcare system. So, also, managing medical records and understanding insurance policies is really essential. A lot of times procedures need to be pre-authorized by the insurance. And so usually the hospitals or the surgery center, or they will They will initiate those authorizations. You should get a notice from your insurance company in writing that you have a procedure. For me, I am having eyelid surgery in the next couple of weeks. And I just, I've been waiting to see if my insurance company would pay for that. So I just recently got my letter in the mail saying that based on my symptoms and based on the evaluation of the doctor, that they're going to approve it. So you should know, you should have some sense of what the process is, if the insurance needs to authorize, whether it's equipment, whether it's home health care, whether it's a surgical procedure, whether it's a medication such as a cancer drug that we know is going to be very costly. Does the insurance cover that? So these are things you need to be aware of before you get stuck with a big ginormous bill for you or for your aging loved one. So be aware of some of those insurance things. One of the good things is create a dedicated folder or a binder for all the medical records. I have a fellow advocate. Her name is Barbara Gaynor. Her advocacy is Braddock Professional Services, and she is both an RN and a legal nurse consultant. And she actually does a workshop preparing this medical binder. So I will put that information in here too. So she does a really good job with that. We have our emergency to go folder, but she takes it one step further. She will actually help you assemble a whole binder with all of your medical information with you. So those are a couple of ways to help manage, keep track, and stay on top of that healthcare system. The next section, number 4, is coordinating care. What does that mean? Coordinating care, it involves making sure that all the healthcare needs are met, whether you have a chronic illness, whether you're needing some help in the home, such as meal prep or assistance getting to doctor's appointments. Coordinating that care is making sure that you be able to identify the needs of your loved one and then be able to coordinate or identify the proper resources that go along with those needs. So that would be considered coordination of care. Again, from making sure that they have routine checkups to emergency visits, and this is another big area where we help families is in this coordination of care, identifying what the needs are, and then what resources does that family need to make, their healthcare goals successful, and whether it's aging in place, what do they need to be safe at home, or whether or not maybe they're looking at assisted living. What is a good assisted living in my area? What type of assisted living do I need? Do I need memory care? Do I, what level of care? These are all things that we can help you do too in coordinating care. So, navigating the healthcare system can really be overwhelming, but, with the right tools and the support, family caregivers can be powerful advocates for their loved ones. And that's what we intend to do. We don't make decisions for you. We don't make recommendations for you. But what we do is we come alongside you and make sure that you have all the information that you need so that you can be, make those decisions. We're the guide. You as the caregiver, you're the hero. You're doing all the hard work. You're making everything happen. We're just the guide, helping you be able to become that hero, so to speak, and be that person that can advocate for a loved one. So I just want to share a real life example, and then we're going to wrap things up. So we had a client. This gentleman had a condition that caused him to be off balance, and he was falling frequently. The problem is he was falling backwards, and that caused him to have, over a period of time, several concussions. And some of the concussions were bad enough that he developed a TBI, or traumatic brain injury. And so now he was dealing with some cognitive, some processing things. He wasn't thinking correctly. Sometimes his speech couldn't find the right words. And the coordination in walking and doing things was even worse. And so they identified what was causing the issue. They couldn't fix it with surgery. And basically he was told that he was going to have to live with this. And so this 2 years later, we came in contact with his son, and his son reached out to us and said, can we help? And so one of the things I thought of right away to make him safe was to see if he could get maybe, and he's very active, under 60 years of age, grandkids. He loved to play with his grandkids. He did coaching and, earlier in his years. And so he was really an active person. And so I thought about, well, what about a motorized scooter or a wheelchair to make him safe to be able to get around and do things and feel more active. And so we started that ball rolling. And so in that process, part of that process for getting them fitted for this chair is that you have to have an examination from a rehab doctor. And so that all coordinated. They met with the rehab doctor, met with the physical therapist, and together they made recommendations for a chair. And so what I did before that recommendation, I actually sent a message to the rehab doctor that was going to justify the need for this chair. I talked about I sent him a message and said all the things that were going on that hadn't been addressed. Well, he accepted this gentleman as a patient. And now we have a rehabilitation doctor that he didn't have before. He just had his regular primary doctor managing. So now he's got physical therapy, speech therapy, working on his memory skills and and those types of things, working with physical therapy, working with a counselor, also working with someone that's doing vision therapy to help coordinate the brain again with the feet moving. So we were able to put all of this and identify all this and put this all together. So that's a great example of what it's like to try and navigate the healthcare system. And he just said to me about a week ago, he says, you know what? I finally feel like I'm being heard. I finally feel that someone, that the medical community is now trying to do something for me. And it really, that really kind of hurt me that this is what it took someone like us to step up. But the bottom line is if you don't know what you don't know and you don't know what to ask for, it makes it very difficult to navigate the healthcare system. So just to recap, navigating the healthcare system as a family caregiver involves really understanding all the components, being an effective advocate for your loved one, learning about managing the medical records, learning about the insurance and what that entails, making sure authorizations are there so you don't get any surprise bills, and then coordinating care. So just remember, you're not alone. If any of this becomes overwhelming for you and you have a family member with a complex situation that you don't feel like you're getting anywhere and you're spinning your wheels, please don't hesitate to reach out to us. We do have a free 30-minute consultation. So we want to hear your story, learn about you, and then we'll see if we can help you. So there's a lot of ways again, with our website, we've got, free resources. We've got our weekly newsletter. We also have a private community where we have discussions. And so we have a lot of things to offer you more information. And also, again, we have those free consultations. So, we want to just encourage all of you as caregivers, even for us as advocates. We have days where navigating the healthcare system is rough. It's not always easy, and we always find a way through. So don't feel that you have to struggle alone. You can, reach out, and we'd be more than happy to help you. So with that being said, we're going to go ahead and wrap it up for this Tuesday Tips, and we look forward to seeing you next Tuesday for another session for Tuesday Tips. Take care.